Good day, everyone. The National Association of County and City Health Officials is pleased to present this online education program. Today's webcast is titled Smoke-Free Policy Development at the Local Level. My name is Marisa Rosso. We are very pleased to welcome all of you to this program. Please note that today's call is being recorded and all participant lines will be muted during this broadcast. Today's presentation will last 90 minutes and includes a specific question and answer period at the end of the session. However, you may queue up a question for us at any time throughout the webcast, though all questions will be answered during the latter half of the call. To ask a question, simply type your question into the chat box area on the lower left side of your screen and then click on the send button. To ask a live question, press *1 on your touch-tone phone. Your participation is key to the success of this webcast, so please don't be afraid to ask questions. I would also like to draw your attention to the links box on the left side of the slides. The links box contains links to websites and documents that are related to today's program, including an evaluation. At the end of the program, we will give you instructions on how to submit your online evaluation of today's program. It will only take a few minutes, and your comments and suggestions are very important to us. And now it is my pleasure to introduce today's moderator, Alexis Forrest. Alexis Forrest is a program associate at the National Association of County and City Health Officials. She works on the Tobacco Control and Prevention Project as well as the Chronic Disease Prevention Project at NACCHO.
Thank you, Marissa. At this time, I would like to welcome our presenters to the program. First, we will hear from Annie Teagan, who's a program manager at Americans for Non-Smokers' Rights. Then, Kathy Wendholt-McDade, the District Health Promotion Manager from Cobb and Douglas County Public Health in Georgia, will speak, followed by Eileen Fisher, who is a volunteer and board member for CAFE, which is Clean Air for Everyone in Johnson County, Iowa. Ms. Teagan, welcome to the program. The audience is all yours.
Great. Thanks so much, Alexis. Again, my name's Annie Teagan, and I work for an organization called Americans for Non-Smokers' Rights. We've been around for a little over 30 years, and our goal is to help cities and states across the country educate others about smoke-free air and the dangers of secondhand smoke, as well as advocate for smoke-free policies. And that's what I'm here to talk to you today about. And I know many of you in places all around the country are in the midst of smoke-free campaigns in your community. Many of you are working hard to help smokers quit the habit and keep new smokers from starting. So, I think we can all agree that an important piece of the overall tobacco control movement is passing smoke-free policies. And we know that smoke-free policies work. We know that they protect the health of workers and prevent people from starting to smoke, as well as help current smokers quit. So I'm really excited to be in this movement with you, and so I'm happy to share a national update with you today. And I know sometimes our work can be frustrating, and it seems like we'll never make progress, and it seems like the tobacco industry is always out there kind of trying to push us down. And so I wanted to start out the presentation by taking a little trip down memory lane to show how far the smoke-free movement has come. What you're looking at, I'm sure some of you on the call can remember this scene. This is an airplane, and it's filled with smoke. And I just wanted to show it because many of you may remember when smoking was allowed on airplanes, way back when. And so thanks to determined flight attendants and advocates from around the country, the no smoking light, that little no smoking light you see on planes, is now permanently lit. So, today, when we're kind of juxtaposing then and now, this is a photo I recently took at the Seattle airport. I'm out here in Seattle, Washington right now, and smoking is now prohibited in so many, not only on airplanes, but in many airports, and in some cases within 25 feet of the airport entrances, like in Seattle where this picture was taken. So we have certainly come a long way. Again, just to remind us all about when this all began, it was in the 70s when local advocates in California really worked hard, and the first law passed actually in 1877, and believe it or not, they only made mention of having smoke-free sections. So they were really fighting to have smoking and no smoking sections. And now we certainly wouldn't consider that a victory, but back then they certainly did. So in the 80s, we saw victory as achieving a smoke-free section, as I said, and it was at this time that more and more science was coming out, and we learned how deadly secondhand smoke really was. In the 90s, we got a little smarter, and we passed smoke-free policies that allowed for smoking rooms, separated by walls, and often, as a little bonus, they'd have a separate ventilation system. Well, at that time, even more research was coming out, and we learned that separately ventilated, separately enclosed rooms don't work at all to protect public health. So we're getting smarter by the decade here. And in about 2000, I would say, and again, there's give and take there, but finally, around then, we really realized, I think, as a movement as a whole, around the turn of the century, that we wised up and realized creating 100% smoke-free policies was really the only way to truly protect health. And we now know, thanks to the research that was done before us and also the Surgeon General report that came out in 2006 on secondhand smoke, we know that there's no safe level of exposure to secondhand smoke, period. So there shouldn't be any exemptions in these laws that allow for smoking to be anywhere inside a building, because it simply won't help. So that's where we've come from. Where are we now? That brings us to our kind of national update. And the story is that you've been very busy because, thanks to all the good work that you've been doing and other advocates around the country have been doing, you can see this slide indicates the number of 100% smoke-free policies at the local level. And it starts out in 1993, there was really only one. Now, in 2007, we have over 200, and we're expecting more to take effect in 2008. And those were local laws again. Now, I wanted to share this with you as well. This map shows the current number of smoke-free laws and areas covered, both local and state, across the country. And I know we're here really to talk about local laws today, but I thought it was important to see that 24 states now have strong smoke-free laws in place statewide, and a few more, they're colored differently with this is orangish pink. A few more, New Hampshire, Illinois, Minnesota, and Oregon have enacted strong smoke-free laws, but they are not yet in effect yet. They're slated to be implemented in the near future. So that's great news. And you can see all the little dots and triangles indicate. It's kind of hard to see on this slide, my apologies, but the little triangles, the little blue triangles are cities that have really strong smoke-free laws, and the green circles are counties with strong smoke-free laws. Now, this map won't show every single smoke-free law around the nation, just the ones that are absolutely 100%, offer full protection and have no loopholes. Next slide, please. Oh, there we go. Sorry about that. Okay, so current smoke-free laws around the country. There are 24 state laws, as I said. There are 2,617 local smoke-free laws. Amazing. And that's just been, in the last year or two, that's also been exploding, in addition to the number of, the explosion of activity we've seen statewide. Now, 619, those are the dots and triangles you saw on the map in the previous slide, have smoke-free provisions that are 100%, whether it's for workplaces or restaurants or bars. At least one of those places has 100% smoke-free coverage, and oftentimes all three of them do. So, and I should mention too that if you'd like to see any of these maps, we have about 20 different maps and charts available to you for your use on our website. And so I encourage all of you to take a look at those. And I think the links that are shown on the left side of the presentation, you can see our website, I think, is listed as the second link. So you can always find more slides there. So we also have seen an influx in outdoor area ordinances. 600 communities now have ordinances that allow for smoke-free entrances. So we call them reasonable distance clauses. Some people call them buffer zones. Basically, it means that you have to smoke away from entrances, air intakes, so that the smoke doesn't infiltrate back indoors. That's the main rationale for that type of provision. There are also almost 600 that have outdoor laws for outdoor places like parks and beaches. Still more are in effect for smoke-free stadiums, sports venues, and entertainment venues, things like that are outdoors. So there's been a lot happening over the last few years. So I wanted to just quickly, let's see. I guess I wanted to mention that we've really been succeeding at the local level. And not only have we noticed it at Americans for Non-Smokers' Rights, but the tobacco industry has noticed it as well. And the tobacco industry doesn't like local progress, and we wonder why. Well, it's pretty clear. The tobacco industry has power at the state and national level. And because they can't fight very well at the local level, because they don't have the people power that we do and that you do, they prefer to battle statewide, lobbying the state legislators basically with their pocketbooks. So they know we have the power at the local level, and it's demonstrated here at a quote by Walker Merriman from the Tobacco Institute long ago. He said, "It's barely controlled chaos at the local level. We simply can't be everywhere at once." So there are tons of quotes like this about the tobacco industry trying to put out fires at the local level. And when we're introducing smoke-free laws, they simply can't be there to fight all of them. So they'd much rather fight at the state level. So I think that's really important to mention, because some of the states have preemption, have what's called preemption. And thanks to the big tobacco, in fact, they were the ones that pushed for these preemptive state laws. The state laws don't allow cities and counties to pass smoke-free laws at the local level. So some of you know very well that you have preemption, and I'll show a map of that next so that you can see whether or not your state is preempted. If it is, I'm sure you know it. and if it's not, be very grateful, because obviously we really want to fight preemption at all costs, and do everything we can to avoid that, because people in these states are really frustrated, and for good reason. And I think you'll see from the next presenter that's going to be on, I'm not sure if she's next or not, but one of the next presenters will tell you that there's really still a lot that you can do in preemption states to kind of chip away at our overall goal of smoke-free air, including some of the things that are listed here on this slide. So, but I was asked really to talk too about what's in a smoke-free law and what does that model language look like. And I first wanted to let you know that on our website, and if you want to call me, we have a lot of resources at your disposal, and we encourage you to plagiarize them as much as humanly possible. We have our model ordinance that is on our website, and it includes 100% provisions for workplaces, including restaurants and bars. And I encourage you to take a look at that. We have links over on the left-hand side for things that you might want to consider looking at. So I encourage you to do that. So quickly, I'm going to go over, though, what your ordinance should definitely include. If you are considering passing an ordinance at the local level, I really can't reiterate enough that we review every single ordinance that passes in the nation, every single one, no matter how many people live in that community. It comes to our office, and then we painstakingly sometimes, review it line by line and compare it to all the other ordinances in the country. So we have the only national database of smoke-free ordinances. So if you've passed a law, your law is in our database. And if you want to make sure of that, you can certainly call me and check. And if you want to compare it to other cities or states, let me know. But I just wanted to say that through all this time and all these ordinances that we've reviewed, we've learned a lot. And one thing that we've learned is that all ordinances should include certain things. And if you want more details, we have a lot of details about this in a document that's called our Provisions of Smoke-Free Air document you can find on our website, or just call me. Every ordinance should include a title. Every ordinance should include findings and intent. And this is the section that says, whereas secondhand smoke kills more people in this country, blah, blah, blah. You know the rest. So it talks about the dangers of secondhand smoke and really explains the purpose for passing the law. This will really help if your law is challenged in court. And you want to make sure that those findings are clearly written into the law. And a lot of people want to save space and they want to skip those. So please don't. Please include a findings intent, even if it's a few paragraphs long. Obviously, you want to have clear definitions. Again, I refer you to the model ordinance. You want to cover all indoor public places, all places of employment, and really also list where smoking is not regulated. If smoking is not regulated in certain places, for example, private homes, if the person in that home is the only person working there. For example, if you have a home office, are you regulating smoking there? If you're not, that would be a good place to state that that's exempted. You want to say that people have to post signs. That should be included. And then there's what's called a non-retaliation clause. And this is there in ordinances to protect workers. You want to make sure that if a worker stands up for his or her rights and says, I believe that there should be, we have a smoke-free law, yet I see people smoking here, my boss is smoking, and I want to stand up and I want to protect myself and I want to say no more. Then that person cannot be retaliated against and cannot be fired, basically, or penalized for standing up. So we want to make sure that that's in every law. You also want to have enforcement provisions, violations and penalties. You want to explain those, and you want to make sure that the violations fit with other, similar laws in the community. You want to make sure there's a public education component, if at all possible, and that really ensures that something's written into law stating that the public will be educated about this issue, whether it's by the public health department or someone else. But you want to make sure to have that in there, and sometimes that includes a budget amount, and sometimes it doesn't. But it's really important to help. It really helps with implementation, of course. There's a provision about other applicable laws, and that basically says that this, even if other laws are on the books that may conflict with certain portions of this ordinance, that this ordinance will still stand. Similar to a liberal construction clause that's in there for legal reasons as well, to state that this ordinance should be liberally construed. Basically means if there's a question about what this ordinance is, who we're protecting in this ordinance, please read our findings and intent, and you'll realize that we're trying to protect all workers. So while it looks like there's a loophole for certain provisions of certain types of bars, please look to our findings and intent to see that we wanted to be very clear and state that we want to protect all workers, so there will be no smoking allowed, just to avoid legal challenges. There should be a severability clause that states that if one portion of your ordinance is ruled invalid for some reason, whether it conflicts with another state law or local law, it really can be severed from the ordinance, kind of taken out, and the rest of the law will remain in place. So that's really an important one as well. So a few of these are kind of legals, but I think it's really important to go through those, and also to have either A&R, we're happy to review your ordinance before it goes to the council, or a local lawyer really look at that to show, to make sure that everything's intact and correct. You want to make sure there's an effective date listed, and we recommend 30 to 90 days. 90 days certainly maximum for how long your ordinance should be, when you should implement your ordinance. Now, there are also outdoor provisions that you can decide amongst yourselves whether or not you want to include. Outdoor stadiums, for example, or the reasonable distance clause that I stated before. That would be a buffer zone outside of a door, windows, or air intake systems. So that's what an ordinance should include. So what should not be included in an ordinance? Well, what we've learned over the years from looking at so many of these ordinances that have come in and seen what's happened in those communities in the aftermath, we've realized that they should not include poor definitions. If you're defining what a bar is or what a private club is, you want to be as specific as possible, so that, for example, if you exempt certain bars, you don't want all your restaurants to be able to legally define themselves as bars. This is kind of common sense stuff, but it's amazing how if we just take a little care at the beginning and define these bars and private clubs and restaurants very well, then we won't be able to, people won't be able to jump in with loopholes and try to get around it. Of course, they should not include any sort of accommodation provision. Now, this is, we often call this red light, green light, and I'm sure a lot of you have heard of it. Basically, it's a tobacco industry tactic, and the tobacco industry would like to say, why don't you just let the people decide where they want to go, and you just put a red light or a green light indicating whether or not there's smoking going on indoors, and people can just decide whether or not they want to enter. Well, obviously that doesn't get to the point of public health, and well, yes, then certain people could choose to go to certain restaurants or bars or workplaces that had either a red or a green light posted. This certainly does nothing to help the workers that are forced to work in the workplaces that still do allow smoking. So we never want any kind of accommodation provision. And again, I probably should just have taken that out of this slide, but I think it's important to note that still there are some areas of the country where the tobacco industry and other front groups are still trying to push these types of provisions. I know in Minnesota it came up where in one area they were trying to push stars, like a star system. It didn't go very far, but they, like 3 stars if you're half smoke-free. You get 5 stars if you're smoke-free entirely. So that really doesn't fit the bill, and it really doesn't help in the long run. So, and of course, ventilation should not be included. We already know even the ventilation experts in the ventilation industry have now stated that ventilation doesn't work to protect public health, and that information is on our website. And I encourage you guys to take that to to your counselor, to whoever's determining what the ordinance might look like. Obviously, no smoking rooms. We know that those don't work at all. We know hours provisions are no good. They sometimes will say, why don't you just have it smoke-free until 9 o'clock, and then usually kids go home and kids go to bed. So what's a little smoke after that? Well, that kind of it takes away from the point that we're really trying to work to protect the workers. So that's entirely unacceptable, and we really don't want those types of provisions on the books. There are hardship exemptions, and those are just kind of what they sound like. If you can demonstrate that as a business you've had a hardship due to the smoke-free law, then you want to make sure that then they want an exemption for that. And those really are we've seen those in a few cities and a few states, and really they're it really steers far away from public health again, and we really want to stay on track with maintaining that this is a public health issue and everyone should be protected. So we want to stay away from those hardship exemptions. Trigger schemes are schemes where you have 3 communities perhaps that are right next to each other. So a trigger scheme would be something like, okay, community A, if community A passes the law, then B and C might say, okay, well, we'll pass if you two. A will, sorry, this is kind of confusing, but so community A will say, we will only pass and implement our law if B and C, community B and C pass and implement their law. And so you're left with this kind of triangle where you're left following the weakest link. So you want to stay away from those types of deals between cities or trigger schemes. Information on that is also on our website as well. I know it's been seen in Indiana and a few other places where they've tried it. But our site is one, luckily, and they never actually took place. But there are a few other things that should not be included in ordinances. One is long phase-in periods, and we see that a lot in statewide laws, which is too bad. But sometimes, you kind of pick your battles. And so we will, in the local level, though, certainly, as I said earlier, you really don't want anything longer than 90 days. There's nothing really in these laws that require a lot of time to prepare. So bar owners and other business owners simply need to alert their employees, put out or take away the ashtrays, and put up a sign. And really that's all they need to do. There really isn't a lot more that they need to do to prepare. So, I encourage you not to be fooled when the industry or the business groups may say that we need more time. Really, 90 days is ample time to get all of that done. And it's ample time for public health departments to send out letters informing businesses that that's what's going to be happening soon. If it's any longer than 90 days, I'll explain why it's a bad idea. The industry can come in, or opposition members can come in and convince the councils, whoever your local government agency is, to weaken the law again. And we really don't want that to happen. So once the law is in effect, what we see is that people love the law. People love smoke-free laws. And once the law is in effect, even if they maybe were fighting it at the beginning, most people, the vast majority of people will embrace the law and won't want to let it go. So that's the trick. If you can get your law into effect and show people really what it's all about and prove to businesses that they're not losing business, then you've won the battle, and it's really hard to roll it back. That's the good news. Ordinances should also not include things like smoking licenses, just allowing certain businesses to apply for and purchase smoking licenses. Certain other provisions similar to the hours provision, the minors-only provision is unacceptable. So we don't want to see anything like that in ordinances saying that, we only care about smoke-free air in places where minors are present. That's really getting us into a slippery slope because you want to make sure that, everyone is protected. And, yes, minors do breathe, but workers breathe also, and they can all be affected. So that's a little bit about kind of what your ordinance should include and what it shouldn't include. And at some point, hopefully in the beginning of any smoke-free campaign or discussion in your community, it's critical to sit down with the entire group, whether you call it a coalition or a campaign, and decide what your goal is and determine if you'll accept anything less than, say, 100% law. And so it's important to determine your deal breakers, basically, as it says on the slide. And one rule of thumb that we like to go by is whatever you choose as your deal breakers, never accept anything that will prevent future progress. For example, if you had a ventilation provision, that would prevent future progress, right? Because when you go back and try to get rid of these ventilation rooms that these bar owners have built, it's extremely difficult to try to get them to remove these costly ventilation systems that they've spent, tens of thousands of dollars on installing. So that's very difficult. So never accept anything that is going to prevent future progress. Another rule of thumb is it's better to walk away with no law at all. No law, just have kind of walk away from the battle, rather than to walk away with a weak law. Again, same concept. It's just going to prevent future progress down the line. So it's best to wait until we have the grassroots power and kind of the chutzpah to really keep it going and to pass something strong that we can all live with and that will last a long time. And we won't need to go back and fix all the loopholes later. So we have a deal breaker document that we've created for you that has some tips on it. And I also have I just created something. It's a worksheet. It's called a deal breaker document worksheet. And I'm happy. We don't put it on the web because we don't want our opposition to get a hold of it. But if you want to email me or contact me at any time at ANR, I can get that to you. And it's kind of just a tool that can help your coalitions work through what the possible deal breakers may be that may come up, and you can decide whether or not in the long run, you'd actually want to agree to those or not. So lastly, I just wanted to touch on some latest policy trends that are going on around the country. One is that we're going for 100% smoke-free environments now. We see very few ventilation provision exemptions, and in fact, we see very few bar exemptions even. We're seeing people go for the whole thing, kind of an all-or-nothing approach. And it tends really to be working, and it also works well for messaging. But I do want to point out that some communities aren't ready necessarily to go for smoke-free bars, and that's still okay. If you want to go for 100% restaurants and 100% of other workplaces, and that's great, and maybe have an exemption for bars for a little while, and that's okay. Obviously, we want the strongest law possible to go into effect as soon as possible. But sometimes communities just aren't educated and prepared to go for bars right then. So that's okay. But when you do pass it, it shouldn't just be 100%, or it shouldn't just be some bars. Make sure that you pass it for all bars and 100% of the air within that bar. So that's one thing that we're seeing. We're seeing 100% coverage and no exemptions. We're also seeing smoke-free gaming, which is really exciting, and it's something that we have not seen much of in the past. We're seeing smoke-free hotels, smoke-free hotels that are voluntarily going smoke-free, and we're seeing a lot of success in the multi-unit housing area. So a lot of multi-unit housings are declaring themselves as 100% smoke-free, not only in the common areas, but in everyone's area, because that can seep through walls and ventilation systems. We're also seeing a lot of progress in the outdoor areas, so smoke-free parks and beaches and things like that. We're seeing smoke-free laws that deal with smoking in cars when children are present, and those laws have passed in Puerto Rico, in New Jersey, and Louisiana, and we know that there have been a number of bills that were proposed this past year, but we didn't see any more passed, but we're expecting it to come up as an issue next year as well. And again, that's at the state level. I think there are 2 laws at the local level on the East Coast that deal with this, but not a lot of other local laws have passed about this issue. And usually they follow along with a child who's old enough to be in a car seat. So you can't smoke in a car if a child is in the car and required to be in a car seat, so up to that age. Local activity, thanks to all the work you're doing, continues to thrive nationwide from really every corner of the country, which is so exciting to us. And statewide activity is really on the rise. So, excuse me, we've seen so much success in the past, really 3 decades, but really in the past 5 years, we've seen a huge amount of success thanks to all the work you're doing. So I guess I just encourage you to keep it up and say thank you, and please do contact me at any time if you have any questions or I didn't explain something very well. Thank you. I'm going to pass it on to Kathy.
Yes, thank you very much, Annie. And now we will move on to the second presentation, which will be from Kathy Wentholt-McDade, who is from Cobb and Douglas County Public Health. Ms. Wentholt-McDade, please go ahead.
Thank you. I appreciate the opportunity to be here. Wanted to also thank Annie, quite frankly, with the Americans for Non-Smokers' Rights. Much of the work that we did locally, we made lots of phone calls to you all and used a lot of your documents in our preparations. So I would advise anyone who's on the call today to utilize your resources. Just wanted to give you a little bit of background about where I'm coming from. Georgia is a tobacco-growing state, and the world's largest cigarette manufacturing plant was located in Macon, Georgia, which was a Brown & Williamson plant. That plant has since closed, lost a lot of jobs, but there are a lot of us who were not disappointed that it left, because that was not something we were proud of having in our state. Also, preemption is not present in Georgia, which does allow for local clean indoor air ordinances to be passed. Preemption has been brought before our state legislature pretty much every year, so it requires continuous education for our residents and legislators in order to prevent it from passing. Douglas County, I work with Cobb and Douglas Public Health, and Douglas County is one of our counties that I'm responsible for tobacco use prevention for. It's located in the metro Atlanta area, but it has a small town feel and has some rural areas in the county as well. The local officials there are very conservative in nature typically. Let's start at the beginning of where our Douglas County Tobacco Prevention Coalition started. It first started in November of 1999 under the strong convictions of Mr. Jerry Stevenson, who totally understood that secondhand smoke was a health issue through and through. And just remember that that was almost 8 years ago, and we've changed quite a bit since then. The early coalition was organizing and building membership base, and it was striving to keep people involved. The coalition members first went into the community to educate them about tobacco use prevention and about the dangers of secondhand smoke. That was our total concept. They presented to government groups, the county commissioners, the city council, civic groups, our community collaborative, the Rotary Club, and others. Also the Douglas County Board of Education and PTAs and PTOs as well. So we were simply giving them education about the dangers of secondhand smoke, not making any further requests. In addition, they went out into the community and were present at health fairs, school groups, churches, Chamber of Commerce events. We held candlelight vigils each year at the county courthouse steps with many of the local and state officials speaking. We usually did that on World No Tobacco Day, and we also participated in the 4th of July every year. As a matter of fact, we participated every year for 6 years straight, so that everyone knew who the Tobacco Coalition was and what they were all about. It was very effective. The coalition is the crux of the campaign, though. Our staff, those of us who worked in my office, we provided resources and education, but as state employees, we could do no lobbying. So the coalition alone were the voice of the campaign. So who those coalition members were led to what our credibility was and our believability, etc. As to why we chose the city of Douglasville for our first attempt at an ordinance, we chose that over Douglas County because initiating a clean indoor air ordinance, most of the restaurants that were located within the county were actually in the city limits of Douglasville. So we chose to go after that jurisdiction first. There were about 190 restaurants in the county, and almost 150 of those were located in the city. So there was our first effort. We did a survey of the Douglas County residents and did that annually in questioning them about their attitudes and beliefs about the dangers of secondhand smoke. So we, through our efforts, increased that knowledge. Residents were starting to respond publicly to the information, quite frankly, some good and some bad. In December of 2000, we got a new chairperson, Pastor John Hughes, a local Baptist minister who had a son who had cystic fibrosis, and so he understood that secondhand smoke could indeed affect the person sitting at the table next to us. So he became our chair in December of 2000. And just to quote him here, he said, "We have a great opportunity to make a difference in terms of legislation, education, and the overall health and well-being of the community that we care about." He brought great leadership ideas, and he was just very adamant in keeping us focused on what our agenda was. We had a strong campaign to get that ordinance in place. As I mentioned earlier, our survey showed that the community knowledge of dangers of secondhand smoke was increasing. The survey was conducted in August of 2000 and showed that 70% of those surveyed believed that secondhand smoke does cause cancer and other diseases. 19% did not believe that it caused cancer and other diseases, and we had 11% of that didn't know. So look at the difference of what 2 years made if you look at what we had here, from our original 70% to 82%. Other information that that survey showed was that 21% of our Douglas County adult residents smoke. That is below our state average. At the time, our state average was about 25 to 26% of adult residents. We had 4% that used smokeless tobacco products, and about 0.5% used both tobacco products. So with our population, that meant the population of Douglas County, that meant that we had 14,600 smokers who lived in our area, and 2,800 smokeless tobacco users, and then about 350 people that used both products. So, it was a decent number of people who had very loud voices, you could say. Now, the Political Action Committee of our coalition, they began a campaign to urge the City Council of Douglasville to enact a clean indoor air ordinance. And this occurred at the City Council meeting on January 31st of 2002. As I mentioned earlier, our work had strictly been on educating about secondhand smoke prior to that. This was the beginning of a very hot debate of restaurant owners who opposed the clean indoor air ordinance. Many claims that it would put them out of business, close their doors. And then, of course, on the other side of that were our coalition members who were looking at what the health issue was and not necessarily concerned about the economic constraints, although the evidence told us that there were no economic constraints to it, but we could not convince people at that point in time. There, I don't think, had been enough ordinances passed at the national level to convince them that it wasn't going to affect their business. The council members decided at that time not to vote on the issue, and instead they sent a resolution to the local legislative delegation for a statewide ban on public smoking. In 2002, our state was nowhere near ready to talk about that, so we knew that that pretty much meant nothing. The representatives from the state recommended support for local governments to adopt their own ordinances first. No one wanted to take that first step. Very easy to ask someone else to do that first. Now, this debate went on for months, and then all of a sudden, this article appeared in the paper in February of 2003. Wanted to tell you, too, that our opposition, as far as our opposition to this city ordinance, were our restaurant owners and managers, bar owners more particularly, those restaurants that had bars. Our bowling alley was very much against it. They threatened to annex into the county out of the city in order to not be affected by this. Once again, it was going to close those doors. Individual smokers were very vocal, pointed fingers at each of us sitting there. They took personal offense to it, really, even though none of our communication had any personal offense to them. And we also, something interesting is that all of a sudden, our little Douglasville had a restaurant association. Never had one before, but they convened to discuss this issue, and as a matter of fact, they had a lawyer to represent them. Never was told, but I suspect that the tobacco industry had a role in that. And we were accused of sending out propaganda. The council members believed that it was important to have citizen input before deciding whether to pass an ordinance against smoking in public. In order to get a public opinion poll on the November 4th ballot, the officials have to ask the city's legislative delegation at the state to introduce local legislation during that 2003 session. They were not settled on two issues, whether the poll would be a binding or non-binding referendum. I'm calling it a poll, but it was really a referendum. And whether any public places, such as sports bars, may be excluded from the smoking ban. So on Tuesday, February 4th, the Douglasville City Council unanimously approved a resolution asking local legislators to place a public opinion poll on that November 4th ballot regarding a proposed ban on tobacco use in public places. I'll be honest with you, that scared me to death because when you're talking about people going out and voting, that's much different from what their actual simple opinion was. Never been in an election before. The bill authorizing the city of Douglasville to conduct that non-binding referendum on public smoking passed the General Assembly in the state of Georgia on their final day as assembly. The date and wording of the referendum was left up to the city council, and that wording was a real controversy to the coalition. There were three positions that members of the coalition were taking. Those amongst us, when you have a coalition of some very strong-minded people, they don't always agree on everything, and so that's something you need to consider as well. We had those who were adamantly opposed to the referendum, absolutely did not want it to take place. We had those who wanted to be supportive, not that they necessarily liked it, but they wanted to say, well, that's a step in the right direction. And there were those who actually thought it was a good idea. So the coalition members had to reconvene and come to grips with how we were going to proceed, because absolutely we needed to proceed in a united front. Now, as the topic continued to be hotly debated in editorials and in small meetings at Waffle House and other restaurants where smokers convened, the city officials announced at a work session in June of 2003 that a special committee would be formed to word the referendum. The mayor said, we want a good cross-section of the community, council members, a representative from the Tobacco Coalition, medical, Chamber of Commerce, and Restaurant Owners Association, and the city attorney That was our mayor said that. Things were quiet for a while the coalition worked with the state in getting, we were working on getting a tax increase on tobacco. And then in June, the coalition launched its Smokefree Douglas County campaign. This group of cross-section of the community actually was put into place, and they did have a representative from everyone that the mayor had asked for. However, when the council reviewed 7 different versions of the non-binding referendum, including one approved by a committee of residents and city officials, the wording that was approved 6-0 by the council members stated, as it says up on the screen, shall the Douglasville city government enact an ordinance to prohibit smoking in buildings open to the public, including office buildings, shops, and restaurants, but excluding designated bar areas in restaurants and certain other accepted areas. I probably don't have to tell you how pleased we were with that wording. I would like to show you next. This is the wording that was written by the coalition and recommended to the mayor's appointed committee. This wording was approved by that committee, that well-rounded group of people. It was approved 5-1. However, the wording received opposition from members of the Douglasville City Council, and they called a special session to work on that wording, of which the general community was not invited. The headline read, Anti-Smoking Coalition Members Disappointed. Our chairman said the referendum question was weakened drastically, as you can see by what we had. You know, it's not going to make restaurants that have bars in the center any safer. What Annie had said about it's still not a public health, not for the health of the public. So after considering the wording changes, coalition members voted to support the referendum as written. We had much difficulty in making that decision, you know, will people even, you know, what does this really mean? Smokefree Douglas County, as we said, was launched in June, just before the July 4th parade, and so we took the opportunity in the July 4th parade to alert citizens of the dangers of secondhand smoke and to make them aware that there would be a referendum and that they needed to vote in favor of that referendum. The logo that you see was designed by a coalition member, and that color theme, that bright yellow, was carried consistently throughout our campaign. Bookmarks were passed out along with yellow butterscotch candy, freeze pops, which were very popular on July 4th in Georgia. We also had fans and pencils that said that children need clean air. The walkers wore their bright yellow shirts, and we also had yellow hazard hats designating that it was an occupational safety alert. We wanted safety for employees. Also during this time, the committee was meeting and trying to agree on the wording of the referendum at the same time. The tobacco use prevention staff with the Board of Health and the coalition held a conference on October 28th of that year, Youth Advocates Rally for Power and Truth. And this conference provided training in youth advocacy, which allowed our students the opportunity to assist with the drive for clean air ordinance. Big youth involvement with our campaign. Reminder calls were made to all of the voters who voted in the city in the past, and reminded them. We were very surprised to find out how many people who said they were not planning to vote because it excluded bars, so that's not what they wanted, so they were not going to vote for it. So once again, that was just a tough issue for us on whether that was something we wanted to support. So, hurrah, the voters in the city of Douglasville overwhelmingly voted in support of establishing an ordinance. 81% of the Douglasville population voted for this referendum. It passed in all precincts. We were, needless to say, just elated at that, and because once again, you don't really know that people are going to go out and vote for it and do the other understand it. So it was very exciting for us. Most of us felt that we had run for office ourselves. Now we had the long, hard road to actually get the ordinance passed. Once again, this was a non-binding referendum. It did not; they were not bound to pass this. So we started out with a smoking ban hearing. They took public comment. For 2 hours, the city officials listened to the pros and cons of how to implement the ordinance, what it needed to be done. The coalition maintained a firm stance that this was a public safety issue and there is no safe level of exposure to secondhand smoke. Members came in their campaign T-shirts, armed with health-related statistics, testimonials from several people with illnesses that were due to exposure to secondhand smoke. Children, doctors, citizens testified on the harmful effects of exposure. Now the news was full of editorials regarding the smoking ban. The coalition was still fighting for 100% smoke-free, and the business owners and managers were still saying that this would put them out of business. So we were, in many respects, in the same situation we were in before. Then the stall. A proposed ordinance to ban smoking in most public places was tabled after Douglasville officials said they needed time to gather more information. They had an 81% vote for this, but they needed to gather more information. So they decided to delay the item for 30 days until they could do a little bit more investigating. At the coalition meeting in March, our chairman updated everyone on the mayor's special committee working on the ordinance, and the city council could vote on the ordinance as early as April 5th. The coalition once again sprang into action, and we paid for a quarter-page ad in the newspaper to let residents know what was happening in the city council. The saga continues, and the city council finds the smoking ban back in their hands. They got quite a few calls, needless to say, from this ad that was placed by the coalition. So this they continued on that work session on April 5th that they could have voted on. So finally, Douglasville's Clean Indoor Air Ordinance was adopted, and it went into effect on May 1st, 2004, just as the mayor had promised back in January. As you may have noticed, this type of work is not for the lighthearted, and I suggest that unless you're committed for the long haul, don't start the battle. You will face many barriers and must be prepared to address them head on. It's just not a simple ask, or I should say it could be a simple ask, but in most cases, at least back in 2003, 2004, it wasn't. So with our city ordinance complete, our county residents wanted to see the entire county pass the same ordinance. A presentation was made to the county commissioners during their work session, and when they met for the regular session, our coalition and all of our youth groups and all of our speakers were prepared. We all wore our bright yellow shirts, had a long line of presenters, the same physicians, school counselors, young people, private citizens. Everyone was there at it again. The opposition at this meeting came from a large group of men who frequented a local huddle house, which was located in the county and not in the city. And so each of them had their turn as well. The ordinance did pass, and on May 1st, 2004, and that was World Asthma Day, and we were very excited. Now, simultaneously, our coalition and our youth groups had been discussing the passage of 100% tobacco-free policy for our county school system. We had discussions with the school superintendents that went well, but we had a snag that occurred when the issue of all school-sponsored events being tobacco-free. In order to be a 100% tobacco-free school policy, it had to include all school events, no matter where they were held. Some of the school events were held in the Douglasville city parks, and they didn't have tobacco restrictions, another barrier. The superintendent made it clear that the school system didn't mess with the city's policies and the city didn't mess with the school system's policies. We couldn't argue with that point, but we couldn't pass a school policy without outside events being covered. Well, somehow, and we didn't try to find out, the city of Douglasville decided to pass the Smokefree Parks Ordinance in the same month that our school system passed 100% tobacco-free school policy. it was the first in the state of Georgia, and we were very proud of them for that. The school system in Douglas County has worked very diligently with us in trying to keep the tobacco rates down with the students. So, having 4 huge successes under our belt locally, the state was then ready to address the smoke-free air as a statewide law. There was another game altogether. Fortunately, the local policies that we passed and a number of other policies that were passed in DeKalb County, which is in the heart of Atlanta, Gwinnett County, and others around the state, there was a new argument that a statewide law would level the playing field for those jurisdictions who had laws in place. We had trainings across the state for adults and youth. Collateral materials were developed, talking points, sample letters to the editors, pledge forms, and information on how to contact your local legislators made available. This is the pledge form that was signed by organizations across the state to show the state legislators. They were all made aware of who signed this pledge. The Georgia Alliance for Tobacco Prevention, they were the integral component that tied all of this together. And in May of 2005, on the last day for signing bills into law, our governor signed the Georgia Smoke-Free Air Act of 2005. Needless to say, there were a lot of happy people that day. It wasn't everything that we were asking for. Back to what Annie had mentioned before as well, that you have to decide, what you can settle for and what you can't settle for. So that Georgia Smoke-Free Air Act went into effect on July 1st, 2005, and it does prohibit smoking inside most public areas and outlines specific guidelines for allowing smoking in and around establishments that serve the public. The Georgia Department of Human Resources is responsible for enforcement of the act, and there are many barriers to making that happen. One of the biggest barriers is that during the same legislative session that they passed this law, they also cut funding to tobacco control programs by about 75%. So although the act is designed to be self-enforcing, so it's not quite as big of an issue as it could have been, we've had very good cooperation with it. So I know that I've taken a great deal of time. I haven't had time to go into many of the details, and just believe me, there are many. The end result is that we have made a significant change in the community norms of our state and our local communities regarding tobacco use and exposure. Our smoking rates declined below the national average for the first time when our funding was available. Now that it has been decreased since then, they are starting to go up just a bit, but we still have very diligent people out there who are continuing the battle against the deadly tobacco disease. And I want to just close with this last slide. This is a quote from Margaret Mead, and our coalition has looked to it frequently, especially at times when we weren't sure that our efforts would have results. But truly, our small group of committed citizens did make that change. So I thank you for your time, and I will give control to the next leader.
Thank you very much, Kathy. And for our final presentation, I would like to welcome Eileen Fisher, who is a volunteer and a board member of CAFE in Johnson County, Iowa, and CAFE is the Clean Air for Everyone. Ms. Fisher, welcome.
Well, hello. Thank you, Alexis, and I'd like to thank ANR also for all of the help that we've received from them. You're probably wondering why I'm a presenter today. I work at the University of Iowa for Iowa's Center for Agricultural Safety and Health, but I was reminded of that this morning when I went to the dentist to have my teeth cleaned, and my dentist was remarking on the beautiful crowns, many that I have in my mouth, and I was telling her, well, I grew up on a farm, I didn't have fluoride in the water, so I had all these cavities, but my sister she had beautiful teeth. She didn't had her first cavity when she was 40 years old. She had spaces in between her teeth, and the dentist said to me, well, does she still have the space between her teeth? And I just I was taken aback, and I couldn't answer her. And finally I said, well, she passed away at 47. She started smoking when she was 17, when she went off to nurses school to become an RN, and she died at age 47, leaving 5 children behind. Often when I go to the dentist, they know that I'm involved in tobacco control and I do all this volunteer work, but I've never had them ask them, about why I do all of these things. So I thought that it was very fitting that on the day that I was presenting about our local tobacco coalition, that it was brought home to me again why I do all of these things. It really is the health effects of smoking and secondhand smoke is why many of us are in this, and why we commit, as Kathy said, the hours and hours of committed time to change the norm about tobacco use. All of you, I'm sure, know about the health consequences of secondhand smoke. I just wanted to include this slide to remind us of how many people die every year, and the great number of people who chose not to smoke, who end up suffering from diseases caused by tobacco, especially as you'll see heart disease. We always think about lung cancer and other cancers, but really from secondhand smoke, the biggest majority of deaths are as a result of heart disease. The tobacco company lied for years about the smoking causing cancer, and then they lied about secondhand smoke causing cancer, as Annie pointed out. Now there's so much data available, and with the Surgeon General's report, there's no safe level of secondhand smoke. People often ask, well, why are we just finding that out now? And being in the College of Public Health here at the University of Iowa, we have many epidemiologists who study the causes of disease, and it used to be in those epidemiological studies, they would ask people, are you exposed to secondhand smoke? And if their husband or wife or somebody in their home smoked, they would say, yes, I'm exposed. But they didn't, that was underreported. And so a lot of times people in those studies were recorded as not being exposed to secondhand smoke when indeed they were. Now with the more sophisticated research that we have, we can measure very accurately a substance called cotinine, which is a metabolite of nicotine, either in someone's blood or in their saliva, so we can get a better measurable estimate of people's exposure to secondhand smoke. And with those better measurements, we've been able to find out, indeed, there are many more deaths from secondhand smoke exposure than we recently thought. In terms of the people going into a restaurant, Annie mentioned that secondhand smoke laws or ordinances that we pass, we're really trying to protect the worker. It's not necessarily the patron going into a restaurant for 1 hour once or twice a week in a smoking restaurant, although we know now that even as little as 30 minutes of exposure to secondhand smoke results in changes in the arteries in your heart. And people who are compromised because of their other health, with their heart disease, asthma, bronchitis, or some other condition, even small amounts of secondhand smoke can have a dramatic effect on them. In the studies of cohorts of smokers, you can see that they have as few as 5 cigarettes a day contributes to an increased risk of heart disease. But secondhand smoke, it doesn't take very much to increase your risk for heart disease. And so when people say, well, it's okay, it's just a little bit of exposure, and this is particularly important for infants and young children, taking them into restaurants. I remember one of our pediatric doctors at the university who spoke at a community forum for us. This was when we first started our coalition. We were doing an educational campaign, much like they were doing in Georgia, and we were shocked when he said in public at this forum, this is child abuse. Smoking in when children are present, is child abuse. Let's just, get that on the table right now. And I thought, oh my gosh, people are going to think that we're, really off the wall. But the pediatricians and the people who deal with children with asthma and birth defects, they see it in their practice. And so many of them are just so passionate about this issue because they know what a lot of the general public didn't used to know, is that a small amount of secondhand smoke has a huge impact, especially on children and people with compromised health conditions. So what can we do about secondhand smoke? Well, the obvious thing is to create smoke-free environments. It's not to, like Annie said, put up a sign so that people know there's smoking allowed and they have the choice of not to come in. That's not going to work. There are so many benefits to having smoke-free environments, indoors and outdoors. As the data from California showed, and I'm sure most of you are familiar with the tests that were done before and after they implemented their smoke-free prohibition of smoking in bars. Within 6 months, the workers' respiratory health improved. They did pulmonary function tests, and the workers were able to breathe better. They had fewer sick days, fewer colds. So there's an immediate health benefit from having smoke-free workplaces. It also reduces chronic disease. Again, California, and it took about 10 years, I believe, but they started having a decline in their lung cancer rate before any other state because they were so far ahead. And thirdly, having smoke-free environments changes the acceptance of tobacco. So fewer people initiate smoking and smoke rates go down, and that's exactly why the tobacco companies don't like smoke-free laws. Here in Iowa, we saw the effects of having a smoke-free environment in our at the University of Iowa in our dorms. And the picture here of the New Yorker with the people that standing out in front of the hospital or smoking is something that we saw over and over. We used to see this around, college dorms, airports, buildings, office complexes, all of these people smoking. And, of course, to get in and out of the building, you had to walk through that cloud of smoke. So it just makes sense that in addition to having smoke-free indoor places, we should also have smoke-free, protect people from secondhand smoke outdoors. And actually there were studies done showing that the nicotine levels when you had a crowd of people standing around smoking, 3 or 4, approached the levels of secondhand smoke exposure that you would get indoors. And then, as I mentioned before, the role modeling. When people are standing outside smoking, it looks like there are a lot of smokers. Often people would ask me, why are so many university students smoking? I mean, the smoking rate among university students must be 80% because it seems like everyone I see is smoking. Well, of course, if they're not smoking indoors, the ones who are smokers, that's the first thing they do when they come outdoors. So we see a lot of smoking on the campus and around doorways, around buildings, and walking down the street. So this is important, and an anecdotal story that I will tell you. When I was giving a presentation at a public health conference in Iowa several years ago, a woman in the audience raised her hand, and she said, my daughter is 18 years old, and I sent her to the University of Iowa as a non-smoker in August. She was 18. At Thanksgiving, she came home. She had a tattoo on her ankle. She had a pierced nose, and she was smoking. And with tears in her eyes, she said, "I can accept the tattoo. I can accept the ring in her nose, but I can't accept the fact that my daughter is a smoker." So I've told that story several times to administrators and people at the University of Iowa because we're an educational institution, and when parents send their children to us, we can't protect them from every danger there is, but we should be doing our best to protect them from the dangers that we know about. And when there's an activity that we know is going to kill 50% of the people who engage in it, we should be doing everything we can to keep them from doing that activity. And I don't think that we're quite there yet. In Iowa City or Johnson County, our local coalition went through all of the things that Kathy said in Georgia. It was fun for me to listen to her because it is a long haul, and you have to be very committed. We worked on passing the Smokefree Ordinance in Iowa City from 1999 to 2001. We had a 2-year campaign when they told us it should take us 6 to 9 months. But while that was happening, we had an opportunity to work on another policy change. In 1998, we had a PTA mom came to us and said, "I need your help. My daughter's 16. She had cancer, or she's 18 now, but she had cancer when she was 16, and she requested a smoke-free room in the dorm at the University of Iowa." So she went to Iowa, and she was assigned to a room with 3 other smokers. And she has done everything to try to get moved to a different room, different roommates, to get her roommates to quit smoking, and she's just run up against a brick wall. The residents on their floor wouldn't help her. She went to talk to the head of housing at the University of Iowa, and they wouldn't help her. The mom was on a safety committee for the university, and she had the opportunity to talk to the president of the university, and none of them would help her. So her daughter was stuck in this room with 3 smokers and she had nowhere to go. They lived right here in town, so the mom said, you either resolve this situation and get your roommates to stop smoking, or you're going to have to move back home because I'm not going to allow you to live in the dorm with those smokers. So they came to our coalition, and we talked to a faculty member who was a law faculty member. We went and met with the housing director, and the housing director said, this is their home. We can't tell them they can't smoke in their home. So the law professor was just outraged at the response that he got, and he said, well, we need to take this to student government. And he got the student to go with him and some coalition members. They presented to the student government at the University of Iowa, and the student government were totally on the student side. They said, this is just it's not right. They won't let us have a lava lamp in our room because it could be a fire hazard. We can't have a pet snake in your dorm room because that would be a health hazard. And yet they'll allow people to smoke when students are falling asleep smoking. There's tremendous fire hazard. Plus they're exposing everybody else to secondhand smoke. So the student government voted to recommend that all university dorm rooms be smoke-free. Well, we worked with the student health organization, or student health, and looked at the smoking rates. And as you'll see from this graph, in the smoking rate among the students was about 52%. Before this all happened, the university had started to segregate smoking rooms. You could request a smoking room. They put all the non-smokers on one floor. So the first floor would be smoking students, the second floor would be non-smoke, and they alternated them. And there was a slight decline in smoking rate from 97 to 99, but as you'll see in the graph, after the dorms went smoke-free, they do this every 2 years, the smoking rates went from about 39% down to 26%. And that all came about because of one student who stood up for her right to have a smoke-free room. So these policies, the smoke-free environments really do have a huge effect on smoking rates. So not only were we protecting the non-smokers from secondhand smoke, but it also helped get to keep students from starting to smoke, because we believed, and we didn't really have the data to show this, but that there were students who were coming to the university as non-smokers, and then they became smokers once they got here. Well, we had that little victory in the dorm with a great success, but we really wanted to pass the smoke-free restaurant ordinance. Iowa had a law back in, I think, 1993. They passed the Clean Indoor Air Law, and all the law did was create non-smoking sections in restaurants. In restaurants that had over 49 seats, if you had over 50 seats, if you had 49 seats, you did not have to have a non-smoking section. But if you had 50 or more chairs, you had to have a non-smoking section. So it was a pretty minimal law. And this is the case where, it would have been better to have no law at all, because with that law, the industry at the last minute, late at night, tacked on a preemption clause. So all of the supporters who thought that they were moving tobacco prevention forward in the state, they supported the bill, ended up at the last minute with preemption, and for 10 years, everybody thought that we had preemption, so there weren't even any efforts to pass smoke-free laws. But in 1999, our Attorney General said he was looking at the law and he thought that there were some loopholes, that we might be able to have a local ordinance, and the only way to find out would be for a city to pass an ordinance, and then if they were sued, the courts would have to decide. Well, there were two cities that did pass ordinances, Ames and Iowa City. Ames was, I believe, in November of 2001, and Iowa City's in January of 2002. So we were pretty happy that those passed. And again, it was a long, drawn-out affair to get those passed, but we used the Americans for Non-Smokers' Rights materials. We had a conference. Stan Glantz came and presented. We used their little clearing the air recipe for how to pass the smoke-free ordinance, and it really does show you how. So I thank them for all of everything we learned. But about a year later, 7 restaurants in Ames sued the city of Ames, and they weren't really shy about saying who paid for that lawsuit. It was totally funded by the tobacco industry. They went to the district court, and the ordinance was upheld at the district court, but then the tobacco industry appealed and went to the Iowa Supreme Court. And in May of 2003, the Iowa Supreme Court issued a declaration that was kind of strange. It didn't really say that we had preemption. What it said was the Ames ordinance is in conflict with the state law, but it didn't say where it was in conflict with the state law. So that was sort of settled it. The cities of Ames, the city of Iowa City was not willing to keep a law on their books that they felt was in contradiction with the state law. They revoked their ordinance. The city of Ames left their ordinance on the books, although they couldn't enforce it. All of the restaurants in Ames who filed, the 7 restaurants who filed the lawsuit against them, against the city, by the time it was settled, they had figured out that this was good for business. People loved having smoke-free restaurants. So all of them followed the law, even though it was no longer in effect. And the same happened in Iowa City. Many of the restaurants continued to be smoke-free. A lot of the restaurants that were restaurants during the day and bars at night went back to being bars, smoking. And there was really nothing we could do. As a matter of fact, a lot of people in Iowa City when they come to our booth at the fair, they'll say, "Oh, thank you, we're so happy that we have a smoke-free ordinance." They didn't even realize that we don't have a smoke-free ordinance, and it's because, you know, they're not going to the bars, they're going to the restaurants, and most of them are smoke-free during the day. So, well, first, after we spent about 5 months just being depressed and not thinking that we couldn't do anything, we finally had to pick ourselves up by the bootstraps and say, well, what can we do? We had a founders meeting in Des Moines and invited, you know, all of the tobacco control people, and decided that we needed to have a statewide organization to overturn preemption. So the little slogan, "Clean Air for Everyone," which was the campaign that we used when we passed the ordinance in Iowa City, is what we used, what we named our statewide organization. And that group has been working for 3 years to get local control back. We are organizing our members to go to every legislative forum. We've done candidate surveys. We have done community forums. And we've had the vote passed to restore local control, but up until last year, it isn't enough to have the vote. You have to have the leadership. You have to have the majority party who's willing to let your bill be voted on. If it can't get out of committee, then it doesn't get voted on. So even though we've had the votes to restore this, it's been an uphill battle. And this year, I think, is the year that we're going to get that back. There are 60-some local coalitions across the state of Iowa, and they have been working on voluntary policies, getting restaurants and businesses to go smoke-free voluntarily. While all of this was happening, we had one tobacco control coordinator in Grinnell, Iowa, who got her hospital to adopt a tobacco-free campus policy. And so our statewide group said, well, we need to continue the fight. We can't have local ordinances, but we can have tobacco-free hospitals, and we can have K through 12 school policies, including the football field, the basketball games, everything can be tobacco-free. So we organized some workshops across the state, developed the how-to kit, and brought in speakers to train our coalitions about how to get their school district, their school board to adopt a school policy. And at one of those regional workshops, Julie Tabatabai from Grinnell presented on the tobacco-free campus at her hospital. So there was a lot of interest in that from the regional, from the local coalitions. And we decided to go do a little top-down work. We went to the Iowa Hospital Association and made a presentation to them about the hazards of secondhand smoke and asked them to make a recommendation that all Iowa hospitals adopt the tobacco-free policy. And the results were pretty startling and overwhelming for us. The first thing, of course, many of the people who are leaders in the Iowa Hospital Association were also leaders or CEOs of the major hospitals. And 4 major hospitals right off the bat decided to jointly announce that they would adopt the tobacco-free campus policy. In addition to that, there was the president of a private college in Des Moines who announced suddenly that their whole campus was tobacco-free. The local coalition, Cafe Johnson County, we had a large teaching hospital. The University of Iowa Hospitals and Clinics, I'm not sure if it still is. It used to be the largest teaching hospital in the nation. It has huge numbers of staff, inpatients, outpatients, and visitors every day, and a large campus. So we applied for and received a grant through the Iowa Department of Public Health called the Harkin Wellness Grant after Senator Harkin, who got some funds for these grants, to work with the University of Iowa Hospitalists and Clinics to get them to move towards a smoke-free campus. We also wanted to work with the health science colleges, College of Dentistry, Medicine, Pharmacy, Nursing, and Public Health, because their campuses sort of surround the hospitals, and we knew that if the hospital adopted a smoke-free policy outdoors, that the smokers would be moved out to the campuses of the colleges. And then in Iowa City, we also have a Kirkwood Community College, which the students at the community colleges generally come from a lower income background sometimes. They're the more non-traditional students, and they have higher smoking rates than the general public. So we wanted to start work with the community colleges as well. The hospital was very hesitant, but they agreed that they would examine their policy at first, and they knew that other hospitals were going smoke-free. So they agreed to meet with us. They formed a task force, and as of July 1, 2007, or 2006, the University Hospital adopted a smoke-free policy. Across Iowa, there are 151 hospitals, and now 87 of those hospitals have tobacco-free or smoke-free policies. Enforcing this kind of a policy is not an easy thing. This is a map of the hospital. There are, in addition to the old general hospital, there are additions in every direction, including down and up, and lots of different places where people can, find a hiding place to smoke. So the hospital decided that they would hire ambassadors. So they hired, and most of these are students that they hire on a part-time basis. They train them, and they walk around in I can't remember what the color of their jackets are, green or red jackets. And when they saw somebody, a visitor or a patient or an employee who was smoking, they handed them a copy of the map which showed where the campus was and told them, you may not be aware, but the University Hospital has a smoke-free campus policy, and they handed them a little ticket for a free beverage at the hospital cafeteria. In addition, the hospital sent out letters to all of their patients. So now every time you get a letter from the hospital reminding you of your appointment, there's an extra letter telling you that their campus is smoke-free and why it's smoke-free, because this is a health issue. So they have done a tremendous job of signage, of educating their doctors, their staff, educating their patients, educating the visitors who come to the campus. It's made a tremendous difference in the atmosphere of the hospital. So instead of seeing the picture that we saw at the beginning with people clustered around the door, those people are now standing. We still have a bit of a problem in the tobacco ramp, but you see people standing in the tobacco ramp with their cigarettes cupped in their hand, hidden behind their arm, and their arm behind their back so nobody sees them smoking. So it's kind of made them closet smokers, I guess, which is a big improvement. They just celebrated this July 1st of 2007, their one-year anniversary of the hospital being smoke-free, and the hospital administrators and that task force that worked to change this policy over the course of about a year are bursting with pride. They are so proud of the policy that they have and how well it went, the implementation and the enforcement, that they had a celebration they called Hit One Out of the Ballpark, and they served free hot dogs and lemonade and popcorn. They had over 500 people, employees, come to the reception to celebrate their goal. And just anecdotally, people came up and said, "This is my one-year quit date. I had been wanting to quit smoking for a long time, but this was what motivated me finally to do it." And so story after story. In the little grant that we had, we did budget about $3,000 to help pay for nicotine replacement therapy. The hospital was very hesitant because they thought this was going to be a big cost to them if they had to help their employees quit and pay for nicotine gum and patches. So we budgeted a small amount of money into our grant. I think the hospital actually ended up using only $800, something like that. The rest of it we used for the university student health to help students who were coming in to quit. So it wasn't a big cost to them. The biggest cost was probably paying for the ambassadors, but even now, a year later, they've still kept a few of those on, and there are a few pockets of places. We knew that this was going to push smokers off of their campus. So in our grant, we said that we were also going to try to include the colleges, the health science colleges. We were given permission to do that, and this is the map of the larger area now. The field house, which is a recreation center, swimming pool, basketball, lap, for people to run, it had quite a problem because the smokers now gathered next to the field house. So the university, after the college passed their smoke-free campus policy on April 2nd, the university passed, they decided to include the field house because they got so many complaints from people about the smokers gathered around that field house. Well, when the colleges went smoke-free, the health science colleges, the only question that our president at that time had was, why not the whole university? He appointed a task force. They spent about 9 months gathering data. They came back last spring and said, yes, we think the university campus should be smoke-free eventually, but they recommended that in addition to the 25-foot barrier around the entrance, that it be a 20-foot barrier around every university building starting July 1 of 2007. So that just went into effect, and we have a new president who just took over August 1st, and she will be making the decision about a smoke-free campus for the whole university. I'm going to stop because I think that we're out of time, but there are resources if anyone has any questions, would like to contact me. These are our websites.
Thank you very much, Eileen. I apologize that we've run out of time, so we're not going to be able to do the question and answer period, but I'm sure that you've all been provided with a lot of great and useful information. So if you do have some questions that you would like to be answered, if you want to either email the speakers directly, I know that Annie has her email address on her presentation, and the other thing you could do is actually email myself, Alexis Forrest, and I am the contact person for this webcast. So on the registration page that you all went to register for this event, my email address is on there, and again it is aforest@nacho.org. So feel free to email me your question, and I can make sure that the appropriate speaker receives your question. We also ask that you please take a minute to fill out our online evaluation, which is listed as link number 11 on the screen. So if you just click on that link, it will take you to our evaluation page, and that's very important for us in order to get feedback from you on what you thought, and as well as additional ideas for other topics you may be interested in. So I thank you all again for the webinar, and I'd like to thank again our presenters, Annie, Eileen, and Kathy, for being with us today and providing us with the information.